Indonesia has alerted its public on the dangers of severe acute hepatitis following the deaths of 3 children from mysterious liver disease last month. The 3 children aged 2, 8, and 11 died in a hospital in Jakarta between mid and late April. The hospital workers found the children showing symptoms such as diarrhea, vomiting, and jaundice that is marked by the skin or the whites of the eyes turning yellow. These symptoms were also found in clusters of unexplained hepatitis cases that have emerged among children across the world. The Health Ministry's spokesperson said that to identify the risk factors for the disease in the 3 cases, the ministry had conducted contact tracing investigations and found that the children had no family history of hepatitis, and they were also tested negative for COVID-19. During an interview with local media, the spokesperson with the Health Ministry said the latest number of the disease as of Wednesday this week stood at 15 and death toll at 5. The Health Ministry has alerted city and district administrations across the country about the disease, instructing them to monitor and report any suspected cases of unexplained acute hepatitis in children.